Good Tuesday afternoon. I'm Charity Menifee, Director of Communicable and Environmental Disease and Emergency Preparedness here at Knox County Health Department. Typically, we start out each of our media briefings with a moment of gratitude. And while I believe it's always important to look for the good in every situation, today I want to kick off today's briefing with a plea to our community. My ask is one that you've heard before. Practice the five core actions all of the time. I know you're tired of hearing it, and I'm tired of saying it, but I'm coming to you today pleading to please take these actions seriously. On Sunday, we had our highest daily number of new cases. Yesterday, we smashed that record, and today we're breaking it again. Yesterday, Knox County had more of its citizens hospitalized due to COVID-19 than at any point during this pandemic, and today we have even higher. And most unfortunately, as you'll hear in a few minutes, today we're reporting our largest number of deaths related to COVID-19. These trends are worrisome and tragic, and when you consider the holiday season just around the corner with more gatherings likely to take place, these trends are extremely troublesome. Now we'll show you a graph that depicts the impact the holidays have, specifically holiday gatherings, have had on our case increases. You can see in the past when we have had a holiday, our cases spike usually about 2 weeks after the holiday, and then they tend to come back down. Take a look at the increase that we're seeing after Halloween. What's different about this time of year is that we have several holidays in a very short time frame. There's not going to be time for the cases to come back down by the time we have our next holiday. In just over a week, Thanksgiving will be here. If nothing about our behavior changes, these numbers will continue to climb at a high rate. So what we ask and what we need everyone to do is please take a look at your plans and see what you want the holidays to really look like. We're at the point where it's time to seriously consider whether hosting a small gathering at your home for the holidays is the appropriate decision to make for yourself and your family to keep them safe, while also considering the implications that hosting this gathering could have on those that you come in contact with in the future. We're all connected in some way, shape, or form. That said, it's imperative that everyone follow the five core actions all of the time. This applies to both at home and at the workplace. Not only will these actions protect you and your loved ones, they protect your family, your friends, your neighbors. They help our hospitals and our hospital staff, our doctors, our nurses, the techs, our emergency responders who are working day in and day out to take care of the sick. By wearing your mask and practicing social distancing or physical distancing, you are helping them. You are also limiting the number of close contacts that have been exposed should you become infected with the virus. With the high volume of new cases and increasing delay in receiving results from the lab, it becomes more and more difficult for our team and public health officials across the state to make contact with all of the new cases and their contacts in our desired timeframes. So please, if you test positive, isolate yourself. Reach out to all those you've been in close contact with and let them know so they can begin their quarantine. If you know you're positive and have been exposed to a confirmed case, don't wait till you get a call from us or somebody from the Tennessee Department of Health. Start your isolation and quarantine now, as soon as you find out, and reduce the risk of spreading the virus to others. We know there is fatigue and frustration, but now is not the time to let your foot off the gas. It is imperative for our health and safety of this community that we work together to reduce the impact of this virus on our lives and our livelihoods. We'll now move on to the local situation. We have 373 new confirmed cases since yesterday's report, giving us 16,036 confirmed cases of COVID-19 in Knox County since March. Additionally, we have 881 probable cases. 14,516 of our cases are considered inactive, giving us 2,263 active cases. 534 individuals have been hospitalized at some point in their illness, and 86 Knox County residents are currently hospitalized. And sadly, we have 7 additional deaths to report today, raising our total to 138. We will continue testing today, tomorrow, and Friday from 9 a.m. to 3 p.m. at the main health department location. However, we will not be testing this Thursday. Instead, we are coordinating 2 flu vaccination clinics as part of the state's Fight Flu TN campaign. It's important to note that it is many of our same staff that coordinates testing of our flu vaccination clinics. Both flu vaccination clinics are posted on our website and our social media pages. If you haven't received your flu vaccine, please make plans to get that done before the holidays. And next week, we will be testing Monday and Tuesday from 9 a.m. to 3 p.m. and Wednesday from 9 a.m. to 12 p.m. We will not be testing next Thursday and Friday. And as a reminder, we are not the only location in Knox County for testing. You can visit our website where we have an interactive map that lists COVID-19 testing locations across our community. And now I'll open it up for questions.
All right, the first question we have is from Jeff with WATE. Are the higher numbers all post-Halloween activity or something else? Bar-related statistical aberration?
You know, it's a little bit of everything. We just look at the timing, and the timing works really well with what we've seen in the past with holidays and spikes that we see after those. And so I think it's probably Halloween's in there, but all the activities that go along with that, gatherings and parties that happen on Saturdays, that can be in restaurants or bars. It could also be at people's homes, all of those things combined. We just wanted to point out that this is timing that we've seen again and again. And we don't have recovery time this time to drop our numbers back down. And so that is concerning to us that we are just going to continue to add to an already extremely large volume of cases.
From Grace with WVIR, on a scale of 1 to 10, how worried are you about the rising case counts and hospitalizations? Please use a number.
I don't get to get out of that. Okay. I'm very worried about it. I mean, I'm at probably an 8 or a 9, considering where we think that we are moving and what we're concerned about happening over the next few weeks. Over the next 6 weeks, we have 3 holidays or 7 weeks maybe that will historically brings lots of people together. And that's why we're asking people to really consider what they're going to do and how they're going to celebrate these occasions and you know, try to make it fun in different ways to help protect our community and keep people safe. But it's very concerning.
From Vincent with the Sentinel, recently there was a major outbreak of COVID-19 at the Arbor Terrace Nursing Home. Are you helping them get that under control? If so, how?
As always, I can't speak about particular cases or clusters. I can tell you that we always work directly with all of our long-term care and other facilities that are having these situations, and we'll continue to do so. And we'll continue to work with them in the future.
From Jeff with WATE, with numbers spiking, do you have sufficient resources to continue contact tracing? It would seem to me that potential contacts would be rising at a geometric rate. How can KCHD keep up?
That is a very good point. And I mentioned it a little bit last week, and now with the numbers we're seeing this week, what we have done is taken the state up on their offer to help us with contact tracing and the initial investigations. We're one of the last regions in the state to do that. And so they will be doing that to help some of the load. And I do think that's important for people to hear, as it's an exponential increase. And so, you know, I can say, to round up our numbers from this week, if we have 400 cases right now, it's 400 people that need to be contacted per case. I mean, it's 400 people that need to be contacted, right? And then you think about all of their contacts. And I'm going to say conservatively that we're looking at 3 to 4 contacts. That's extremely conservative. That's probably household contacts for most people, and not people they've been gathering with at work or in social settings and those type of things. Just for our county alone, we can be looking at 1,200 people daily that we need to reach out to. We need to educate on how to prevent the spread of this disease. And then think about that across the state. Yesterday, the state had 8,000 cases. We could be looking at 30,000 plus people that need to be contacted for this one day. And that is challenging. And so that's why we really want everybody to, you know, take personal responsibility when you know you've been exposed or you've done that you've tested positive. Please isolate, let your contacts know. If you're a contact to a case, you need to quarantine. And do everything that you can to prevent the spread of this disease, because it is, and those numbers just grow and grow and grow based on our case count.
From Brian Hornback, early voting and election day were at the same time as Halloween. Could the long waiting lines have been a spreader event?
You know, that's probably could fall into that. We haven't heard a lot of that, but I think the nature of those with people social distancing in line, wearing their masks for the most part, is a very different situation than what, you know, I saw with my own two eyes on Halloween with groups of people gathered together. People weren't wearing masks and those types of things. I'm not saying that it wasn't completely a factor in what we're seeing right now, but I don't know that it was to the extent that what we typically see from holidays is what we're seeing.
From Jeff with WATE, do you know of any link between these 7 most recent deaths? Do they include the 6 from Arbor Terrace?
I can't speak about specific case and clusters. I can say that they're not all related to each other.
From Abby with WVLT, are you planning for any overflow areas like the Expo Center?
At this point in time, and that's a great question to send to the hospitals, but it's really focusing on hospitals, making sure that they have what they need to continue to meet the needs of the patients within their walls. That's a better situation for everybody involved, and that's still the priority at this time. And they are continuing to maintain capacity at this point.
From Vincent with the Sentinel, can you confirm which month had the highest number of deaths so far and how many deaths were logged during that month?
I don't have the exact number, but I'm pretty positive that it's this month so far. And we'll get back to you with that to get you the exact data.
From Grace with WBIR, from a contact tracing perspective, are you seeing more healthcare workers getting sick?
Not any more than what we've seen before. There's not anything standing out. We do have cases, as you see in the reports on the state website, and I think where you're getting with this is long-term care and with those employees as well. But that's pretty much standard. The numbers we've been seeing across the pandemic for healthcare workers outside of that population.
Also from Grace with WBIR, not to sound like a broken record, but we're getting it from our viewers. Has anywhere in the country, but I wonder if you meant county, hit a herd immunity level yet?
No. And again, we're not going to be able to get to that point without a vaccine. And it's just not a safe way to do it. If we do it via natural illness, again, our hospitalizations will go up, as you've been seeing, and our deaths will continue to go up. And that's really something that we're trying to avoid. And so we'll continue to, and immunity right now, as far as we know, thank you, Dr. Buchanan just brought up, right now the data is showing about 3 months of natural immunity. And so that plays a role as well. And still more research is being done on that. But that does complicate things when you want to take a herd immunity strategy, if it's not a long-term immunity naturally.
From Abby with WBL, rise in people wanting testing before the holidays and possible travel. How long is the current wait for tests done through the health department?
I would probably expect there will be a rise. And again, we really want to stress that that's a point in time. We've seen, in sports teams and with public official gatherings and testing as a sole strategy doesn't always pan out. And again, there's 2 to 14-day incubation period where you can test positive at any point during that time. So we encourage people, if you're going to get tested, that's great, but continue to please follow the 5 core actions. Act on it though. If you do get tested and you find out you're positive, please do that as well. Wait times. I don't know if you mean waits to actually get the test, which is the line outside, and that's actually running pretty quickly. It's a pretty short wait, and I don't have the exact time, but it's not that long right now for us. And then we have been seeing anywhere between 4 and 7 days on return time frame for labs to come back, if that's what you're asking for our internal testing. And a lot of folks are seeing increased turnaround times as well.
And then Claire with WUOT had a similar question to the one from Abby from WVLT. So Claire, if you had a further question, please go ahead and submit it and I'll read that out loud. Jeff with WATE, the latest White House task force report says there is, quote, aggressive, unrelenting, expanding broad community spread across the country, reaching most counties. Is that true for Knox County? It calls for increased mitigation efforts, saying current efforts are inadequate. What could those increased efforts look like here? What can we do as a community?
I think we're absolutely seeing community-wide spread, robust community-wide spread. That's the effects of why we're seeing these numbers. And as far as what else we can do, you know, been thinking about this a lot, and we've talked about it a lot, and kind of at a loss for what we can say, what more we can say at this point. We have the 5 core actions, and those are our tools in our toolbox. There aren't any more right now. And people need to know that. And we need people to follow those all the time, because outside of that, outside of the broken record that we are, I don't know what else to say. And frankly, I'm at a loss for that. Ultimate decisions on what will come and what measures are taken, as always, are the Board of Health, and they'll talk about that and make those decisions. But we need people to practice the 5 core actions all the time.
From Grace with WBIR, can you compare and contrast the relative risks of outdoor sports like football, et cetera, with indoor sports like basketball?
You know, there's a lot of things that come into play there. The circulation, the closeness of the people, the people that are watching the sporting events. When you're indoors, it's much riskier typically. There's the and air circulation and flow. It's usually better outside. So again, the 5 core actions need to be followed in those situations as well, as much as possible.
From Vincent with the Sentinel, it seems like with this level of community spread, the safest thing to do this holiday season is to spend time with your own household. Am I reading this accurately?
I really think people need to seriously consider that. Yes, Vincent. You know, that's what I'm doing with my family, and really encourage people to think about that. I mentioned a little bit before how we're all connected, and I don't think people always think outside of, you know, their immediate family and friend group, but you know, I could be exposed, and then my spouse could work, you know, in a nursing home as a physical therapist or something like that. And there's connections that come from connections that we don't always think about. And so we need to think big picture. We need to think as a community on how we can help support and protect each other.
From Brian Hornback, with more individual schools going to online, should Knox County go on a system-wide online only?
That'll be up to Knox County Schools, and they'll discuss that and make the best decisions that they can make for the protection and safety of their staff and their students, while also ensuring that education goes on. So that'll be a great question for them.
From Jeff with WATE, is there a firm time for how long a person should wait between potential contact and getting a test? The 2 to 14 day range seems awfully long.
The general recommendation is about 5 to 7 days to get your test from your last known exposure. Most people will test positive within that time frame, but not everybody. Again, it is 2 to 14 days, and so most of the time we do suggest that 5 to 7 day window if you're wanting to get tested after exposure.
From Grace with WBIR, I know we've talked about this before, but what's the typical lag from cases to hospitalizations to deaths?
So yeah, I think it's about a 3-week total time period there. It's what we typically see, 3 to 4 weeks. So you have cases, they have to get sick, they have to then get sick enough to end up in the hospital, and then deaths fall from there. So it's typically about 3 weeks. We'll see that lag in there.
From Abby with WVLT, have you been working with local colleges to provide guidance to students who may be headed to other states with higher case counts with the holiday?
We've spoken to University of Tennessee and are aware of their plans. Haven't outside of that. If anybody has questions from local colleges and wants to get some advice from us, they can always reach out. But I think the general recommendations are out there from the Tennessee Department of Health and CDC. And again, revolve around whether you go home or you stay here, following those 5 core actions all the time.
Grace with WBIR, what are the risks of holding large indoor gatherings if social distancing and masks are being followed?
Let's just take the mask out of that equation and talk about the physical distancing. If you cannot physically distance everybody in that gathering, then you really need to think about whether or not you're going to do it. Masks are complementary strategy, but they're not the sole strategy. The biggest thing that we really need to do is keep people separated from each other. And as humans, it's natural for us to flock to get together and want to be closer to each other, and you do it without even realizing it. And so if you can't do that, if you can't ensure that, really think about whether or not you want to have that activity.
I think she was asking if they are being followed, what other risks?
Oh, I'm sorry, I misunderstood. Well, well, then I don't know how to answer that question. I don't think I'm tracking it correctly. I mean, there's still risk associated. So none of this is 100%. And it's something still to consider whether or not you want to have those activities at the time.
Let's see, a couple more questions coming in. Jeff with WATE, do you have any idea how much higher this spike will go? Where are we on the curve?
It's pretty straight up right now. Again, we're in the process of seeing some pretty steep growth. And that's going to take some time for that to come back down. Hopefully we will, but really, this is up to you as a community to decide what this looks like. And we need you to invest in it. It's challenging, it's hard, but this is, at this point, it's truly up to the community to decide whether behavior is going to be changed, actions are changed to really make an impact here over the next few weeks.
Grace with WBIR, have you all worked with UT on their upcoming graduation plans?
We were made aware of their upcoming graduation plans and were able to provide, given the opportunity to provide input.
From Vincent with a Sentinel, it seems to me with a 3-week lag time, there is a very real chance that someone who catches COVID-19 at Thanksgiving could be sick or dead by Christmas. I'm not trying to be alarmist here, but I haven't heard this point emphasized yet here. Do you have any comment?
You know, I do think we've made this point many times that that all links together, and I think I've described it as dominoes previously. And so we always see throughout this pandemic over the past 9 or 10 months, however many months we're in it now, that increases in cases equal increases in hospitalizations, which then trends to increase deaths. And those are absolutely linked together. And so, yeah, the time frame could potentially be by Christmas, and that's why we're pleading today. That's why we opened it up with a plea today that people follow these guidelines and help stop the spread of this disease, so we don't have to continue to report numbers like we're reporting today.
From Abby with WVLT, outdoor seating at restaurants was very popular during the summertime. Now that it's getting cold, are heated, tented areas safer than eating indoors?
You know, if they're not opened up, they're not any safer. And so just keep that in mind. Think about all your options. You know, takeout's like always a great option, and still you're benefiting the restaurants as well. And you know, I tend to tip really well these days to help make up the differences. And so I think that all of those things that we can do to help people continue on with their livelihoods, but while also being safe, is important. So if they're closed in tents, they're going to be pretty much the same risk as what you have inside.
All right, any further questions, please go ahead and submit them now. All right, not seeing any further questions come in, so thank you all for your time, and we will be back again with you on Thursday at 12:30. Have a good and safe rest of your day.